Hi, Miss Davis. My name's Haley. I'm going to be your student nurse today. I'm going to shut this door just to give us a little bit of privacy. Go ahead and wash my hands. Before we get started, can I look at your scan and can you tell me your name and your date of birth?
Shirley Davis, 10-270.
Good. And then, Miss Davis, do you have any allergies I need to know about today?
Not that I know of.
Are you in any pain? 0 being none, 10 being the absolute worst?
No.
Okay, good. What we're going to do is we're going to do a little head to toe assessment of you today. It should take no more than 20 to 30 minutes. Sounds good?
Yeah.
Okay. Patient appears to be in no signs of acute distress. The mood and the speech, or the mood is pleasant. The speech is understandable. Miss Davis, can you tell me where you are?
At the hospital.
Can you tell me around what day it is?
Middle of the day.
Good. And can you tell me what brought you in today?
I just wasn't feeling well.
Okay, good. Patient is alert and oriented ×4. Miss Davis, first we're going to start with the little skin assessment of you today, okay?
Okay.
So just go ahead and turn your hands like this. Skin color is appropriate for ethnicity. Skin is warm to the touch. There is no signs of lesions, infestation, or lesions, wounds, or incisions bilaterally. Miss Davis, what I'm going to have you do is turn your hands over like this. And I'm just going to look at your nails. Nails are smooth and round in contour. They're pinkish in color and all 10 digits. I'm just going to squeeze them a little bit. Good. Capillary refill is less than 2 seconds in all 10 digits. Miss Davis, we're going to do a head assessment next. So head is normal cephalic. Facial features are symmetrical. I'm just going to go ahead and have a look in your hair. There are no signs of lesions or infestations in the head. Next, Miss Davis, what I'm going to have you do is I'm going to have you clench your teeth. And I want you to hold your teeth clenched, and I'm just going to feel around, and I'm going to add a little resistance on your chin, okay? Okay. Clench your teeth. Good. Cranial nerve 5, the motor of trigeminal is intact. Next, Miss Davis, what I have you do is I'm going to have you close your eyes. Whenever you feel this, go ahead and say now, okay?
Now, 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 now.
Good. The sensory part of cranial nerve 5 trigeminal is intact. Next, Miss Davis, what I have you do is I'm going to have you smile. Go ahead and close your eyes and show me your teeth. And go ahead and open your eyes. Puff your cheeks like this. Cranial nerve 7 facial is intact. Okay, Miss Davis, what I'm going to have you do is I'm going to put my hand on either side, apply a little resistance, and go ahead and just turn your head either way. Good? Good. Now I'm going to apply resistance on your shoulders. Go ahead and shrug them up. Good. Cranial nerve 11, spinal accessory is intact. Okay, next, Miss Davis, we're going to go ahead and do an eye assessment for you today. So I'm just going to have, there is no redness or discharge in either eye. I'm going to go ahead and have a look. The conjunctiva is pink in color bilaterally, and the sclera is white in color bilaterally. Miss Davis, I'm going to go ahead, I'm going to get my pen light, and just look straight at me. I'm going to go ahead and just measure your pupils. Good. Good. Pupils are 6 millimeters bilaterally. Miss Davis, I want you to just look at my light, okay? It's going to be a real quick flash, okay? Good. Good. Next, what I have you do is I just want you to follow this pin light to your nose, okay? Good. Pupils are equal in size. They are round and reactive to light, and accommodation is present. Miss Davis, I just want you to follow my pin light, okay? Good. Good. Cranial nerve 3, ocular motor, cranial nerve 4, trochlear, and cranial nerve 6, abducens are present. Miss Davis, I'm going to have a look in either ear. Okay. There is no discharge or redness in either ear. Can you turn a little bit this way? What I'm going to do is I'm going to whisper 3 words, and then I'm going to just have you repeat them back to me, okay?
Okay.
Yellow, blue, green.
Yellow, blue, green.
Good.
Black, white, red.
Good. Okay, go ahead and face me. Cranial nerve 8, acoustic, is intact. Next, Ms. Davis, we are going to go ahead and do a nose assessment of you. So I'm going to have you just look up a little bit. Good. I see the nose, the septum is symmetrical. There's no deformities or drainage in either nose. I see no signs of inflammation. Next, what I'm going to have you do is I'm going to have you just plug one side of your nose and go ahead and just sniff in. Good. I'm going to plug the other side. Good. Patency is present in both nares. Next, Ms. Davis, I'm going to have do a little mouth assessment of you, okay? So the lips are pink and moist. Go ahead and open your mouth. Tongue is pink and moist, and gums are pink and moist. Ms. Davis, I'm going to have you open your mouth and just say "ah" for me, okay?
Ah.
Good. Cranial nerve 9, glossopharyngeal is intact. Ms. Davis, I'm going to have you swallow, and I'm just going to feel while you swallow. Good. Cranial nerve 10, vagus is intact. And lastly, Ms. Davis, just go ahead and stick your tongue out and move it side to side. Good. Cranial nerve 12, hypoglossal is intact. All right, Ms. Davis, we're going to go ahead and do a respiratory assessment of you now. So I see no signs of accessory muscles noted. What I'm going to do is I'm going to listen to a few of your breath sounds, okay? So just go ahead and breathe normally. I'm going to use my diaphragm part on my stethoscope. Right upper lobe, left upper lobe, left upper lobe, right upper lobe, right middle lobe, left upper lobe, left lower lobe, right lower lobe. Good. Breath sounds are equal and clear bilaterally. Ms. Davis, go ahead and just rotate a little bit. And I'm going to go ahead and just check your posterior side of your breath sounds. Left upper lobe, right upper lobe, right lower lobe, left lower lobe, left lower lobe, right lower lobe. Good. Breath sounds are equal and clear bilaterally. Ms. Davis, we are going to now do a cardiac assessment of you. So I'm going to just kind of feel around on your either arm and down your legs, okay? Good. No edema is present on either upper or lower extremity bilaterally. Ms. Davis, next what we're going to do is I'm just going to feel your pulses kind of throughout your body, okay? So I'm going to start with your carotid. Good. Carotid has a +2 normal rhythm bilaterally. I'm going to go ahead and I'm going to feel your radial pulse. Okay. Radial pulse is a +2 normal rhythm bilaterally. Next, what I'm going to do is I'm going to have a listen to the posterior, or I'm going to feel around for your posterior tibial pulse. Good. +2 normal rhythm bilaterally. And lastly, I'm going to have a feel for your dorsalis pedis pulse. Good. +2 normal rhythm bilaterally for the dorsalis pedis pulse. And Ms. Davis, next what I'm going to do is have a listen to a few of your heart sounds, okay? I'm going to start with the diaphragm side of my stethoscope. So, right second intercostal space aortic, left second intercostal space pulmonic, left third intercostal space Erb's point, left lower sternal border tricuspid, left fifth intercostal space midclavicular mitral. Next, I'm going to go ahead and have a listen on the bell side of my stethoscope. Right second intercostal space aortic, left second intercostal space pulmonic, left third intercostal space, urge point, left lower sternal border, tricuspid, left fifth intercostal space, midclavicular mitral. Okay, good. Next what we're going to do is we're going to do a little GI assessment of you. So I'm going to have you lay down and put your head that way and put your hands down. So the abdomen is symmetrical, the contour is the same throughout, and the abdomen is round. Ms. Davis, what I'm going to do is I'm going to listen to your vowel sounds for a little bit. So just go ahead, breathe normally, and just relax. So I'm starting in the right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Good. Vowel sounds are normal and active through all 4 quadrants. Ms. Davis, next what I'm going to do is I'm going to palpate in each part of your stomach, so just let me know if you have any pain, okay?
Okay.
Right lower quadrant. Right upper quadrant. Left upper quadrant. Left lower quadrant. Do you have any pain with that?
No.
No pain, tenderness or distension noted in all 4 quadrants of the stomach. Come back over there. Okay. Ms. Davis, you can go ahead and sit up now. What we're going to do is a musculoskeletal assessment. So first we're going to start with the upper extremities. I'm going to have a look at your elbows. Elbows are symmetrical, contour is the same throughout. I'm going to just have a feel around. So let me know if you have any pain, okay? Over your hand. Just going to move it a little bit. Good. Same on this side. Okay, good. Ms. Davis, what I'm going to have you do is I'm going to have you stick your arms out. Go ahead and flex them. Go ahead and extend them. Can you turn them in? Can you turn them out? Good. Range of motion. Patient has full range of motion in either elbow bilaterally. Ms. Davis, what I'm going to have you do next is I'm going to have you stick your arms like this. I'm going to apply a force and just go ahead and resist against me, okay? So push down. Good. Now pull towards me. Good. Patient has +5 muscle strength bilaterally in her upper extremities. Next, what I'm going to do is I'm going to check your hands and your wrist. So I'm going to just feel around at first. And again, just let me know if you have any pain with any of this. The contour is the same throughout either hand and wrist, and they are symmetrical. I should have said that before I started palpating. Sorry about that, Ms. Davis. Next one I'm going to have you do is I'm going to go ahead and have you flex the wrist like this. Extend them. Go ahead and spread your fingers out. Spread them out like this. Close them, and then spread them. Good. I'm going to go ahead and have you do a fist. And then can you take your thumb to your pinky? There you go, good. Patient has full range of motion in either hand and wrist bilaterally. All right, Ms. Davis, next what we're going to do is we're going to do a knee assessment. Can you lay down for me, please? And just put your legs straight here. Now I'm going to just palpate either knee. Let me know if you have any pain with this. Okay. The knees are even in contour and symmetrical, both bilaterally. Ms. Davis, go ahead and sit at the foot of the bed again. Okay. Ms. Davis, can you go ahead and put your knees out? Flex them. or extend them, sorry, and then flex them down. Good. Now I'm gonna apply a little bit of resistance and just try to push against me. Good. Now extend them, and then now push down. Good. Patient has full range of motion and either leg bilaterally, and her muscle strength is a +5 bilaterally. All right. Next, Miss Davis, I'm gonna go ahead and have a look at your feet. Feet are symmetrical. Feet and ankles are symmetrical. The contour is the same throughout. I'm gonna go ahead and palpate. Just let me know if you have any pain with any of this. Okay. Good. Okay, Miss Davis, can you go ahead and flex your feet? Can you extend them? Point them? Good. Can you turn them in? Can you turn them out? Good. Patient has full range of motion and either feet bilaterally. All right, Miss Davis, what I'm going to do is I'm going to touch a little part of the underneath of your foot. I need you to close your eyes and just say now when you feel something, okay?
Now. 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 Now.
Okay, let's do this one.
Now. 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 Now.
Sensory function is noted and either foot bilaterally. All right, Miss Davis, next what I'm gonna have you do is gonna be the last thing in our musculoskeletal assessment. I'm gonna have you go ahead and actually come stand over here by me. I'm gonna have you walk about 10 feet in front of me that way. Good, now turn around and walk towards me. Good. Go ahead and sit down for me, please. The patient's gait is smooth and rhythmic. All right, Miss Davis, I think that completes the end of our head to toe assessment of you. Before I leave, are you in any pain anymore?
No.
Good. Okay, I'm gonna make sure your bed is in the lowest position, your side rails are up, it is locked, your call light is in reach. If you have anything that you need, again, go ahead and press that call light. I should be back to check on you in around an hour or so. But other than that, thank you for letting me do your assessment today.
Thank you.
I'm just grab my hands and close out.